Okay, so we're going to do some anatomy for the neck and head. And new person on the table, we've got Sarah Cohen here, who teaches in Worcester. So she's come to play with us today. So, all three types of joint are present in the head and neck. So we've got the fibrous or immovable sutures of the skull. We've also got the teeth in their sockets. We've got cartilaginous joints with the vertebrae and the intervertebral discs in the spine. And then we've got a synovial joint at the T and J. So if Bear just opens and closes her mouth a bit and clenches her jaw a bit, we've got the temporomandibular joint there, which is a synovial joint. So that's our joint recap. We've also got some muscles, many of which we've worked with before. So we're going to just remind you of levator scapulae, coming up from the medial border of the scapula up to the vertebrae. Upper trapezius, coming up from the acromion to the occiput. And occipitofrontalis at the back, the occipitopart frontalis at the front, with the aponeurosis linking them together. And supraspinatus at the back of the shoulder above the spine, a bit hard to see this way over, but we've come across that one before. Two new muscles that we're going to play with today. One of them, super long name, sternocleidomastoid. The name tells you everything you need to know. Coming from the sternum, which is the sternopart, cleidopart relates to the clavicle. So we've got an attachment, sternum attachment on the clavicle, and they both come up and attach to the mastoid process, which is a little bony bit below the ear. So that muscle is the one you can get a grab on at the sides here. Both working together will flex the head. Do you want to just lift your head up there? See them coming into action there, and let your head back down. If you just have one working at a time, then you get a lateral flexion to the same side. So let's have a lateral flexion, or a rotation actually to the other side. And our other muscles we're going to look at is another group of muscles called scalenes, and I'm just going to rotate your head a little bit. The scalenes come from the transverse processes of the cervical vertebrae, and they come out down to the upper couple of ribs. So they form the side of the neck, largely behind sternocleidomastoid. And there you go.